we're bringing healthcare to the people.
Rural areas in general are typically very medically underserved, and we're really helping to bridge that gap.
ODU Community Care comes out to Franklin and Southampton to provide medical services, free medical care for the community. It's about 50 miles away from Norfolk, Virginia.
This is part of our Western Tidewater initiative that we have with ODU Community Care. We're partnering with the school system for our brick and mortar clinics, also with the food bank, and we also have our mobile health van that services this area.
There was a delay in getting kids into school, particularly preschool and kindergarten, due to not being able to get physicals to be able to start. And within the high school, kids were not being able to play the sports and do the other activities and things of that nature to keep them active.
It's a huge medical desert. There's not very many primary care providers out here. So we bring healthcare to Franklin.
And we recently, over this past year, received additional funding from the Obici Healthcare Foundation, and that's really supported our efforts and been able to make us grow.
And we have our mobile clinic set up today. We are in front of Paul D. Camp Community College. Our mobile clinic is actually outfitted with 2 exam rooms, a waiting room, and we have some point of care testing that we can do here in our clinic.
Because there is such a significant shortage and hiring of nurses at the bedside, this partnership has also allowed us to increase the workforce development of our nursing students, both in the hospitals and outside of the hospitals.
We have a school-based health clinic embedded into Franklin City Public Schools to provide services to the community, but mainly focused on kids here in the Franklin City Public Schools.
There's a lot of barriers to the access of care, not just for transportation for parents, but even taking time off of work if they do have transportation. So just creating that greater access to care really allows us to care better for the community.
We have had the greatest response from students, the staff, the school administration, the school board, members of the community.
They offer great services and people are nice. They hear you and they give solutions to any issue that kids can have.
Really integrating the community aspect into our curriculum, ensuring that our students are receiving these competency-based opportunities.
We are providing clinical experiences in our free healthcare clinics for these students to give them a better view of what community health actually is.
I actually am from the Western Tidewater area. I grew up close to here, so I think it hits home for me, especially to be able to come out here and provide these services to the community.